when you're skiing down a mountain and you're kind of in the same tracks that you're always in. Those are kind of like the grooves of your mind. And what we're trying to create is neuroplasticity. We're trying to find the fresh powder where we start to create different pathways that could support your behaviors, your psychology, your immune system, your neurology, your endocrine system in a fresh way.
Dr. Sara Gottfried, so great to be with you once again.
My pleasure. Happy to be here.
Okay, so let's get into psychedelic-assisted therapy because this is just, I think, among, if not the most exciting new developments in medicine. And it was, kicked to the curb for 40 or 50 years. And now it has come back in full force with, a ton of clinical research now coming around it. So, and I know that this has become a just very focused and keen interest of yours. So what is your experience with it? I know that now you've gone through a number of certifications. Maybe explain a little bit of what that was like and what that entails. And then maybe we can talk about some of the more prevalent therapies that are out there.
The certifications that I've gone through, the most profound was with the Integrative Psychiatry Institute. So that's based in Boulder, but it takes people from around the world. And mostly it is for therapists who want to add psychedelic-assisted therapy to their work. I've been a health coach for most of my career. It's something that I started about 20 years ago. And so I was grandfathered in as an MD who does a lot of counseling and coaching for my clients. And it was a profound experience. So when you go through certification, we were trained in 3 modalities: MDMA, and that was part of the MAPS training, psilocybin, and ketamine. So those are the 3 that I think are going to be more widely available first. We've got ketamine already available. It's FDA approved. It's used as an anesthetic. It's FDA approved in its intranasal form for treatment-resistant depression.
Right.
I live in Northern California, where we've got a ketamine clinic on almost every street corner. And that's been interesting to watch, but also gives us some caution because there's a way that it gets over medicalized, and we have to be careful about that. So MDMA, we hope, will become FDA approved for the treatment of trauma, post-traumatic stress disorder, sometime in the next year. We've got now 2 large phase 3 trials, randomized trials, showing how effective it is. And as I mentioned before, it's about double the efficacy of the standard of care, which is mostly talk therapy, sometimes trauma-informed, with or without selective serotonin reuptake inhibitors. So that's really exciting. And, the certifications that I've done are in preparation for this rising tide of people who have had, less than effective treatments for their trauma. And now there's something that is much more effective. The other 2 certifications that I completed were with ketamine. And so one of the things I'm interested in is I've done a lot of one-on-one psychedelic-assisted therapy as a client, and then increasingly as a someone who walks the path with a person who has a level of stuckness or trauma or something that they're trying to resolve. And I'm really excited about the public health benefits, especially for groups, for, I don't want psychedelic assisted therapy to become this, kind of treatment only for the people who can afford it. I really hope that it is more broadly available. And I think group treatment is probably the way that we're going to be able to do that.
Yeah.
There's also a long history of indigenous use of many of these medications. especially psilocybin, ayahuasca, um, you know, the Sonoran toad. So there's a long history of that, and there's a lot that we need to learn from and a reverence for uh, indigenous practices that I think are important to this story. In the Bay Area, I'm involved in a nonprofit that is called Healing States of Consciousness, and we're trying to bring first with ketamine, psychedelic-assisted treatment to first responders. So starting with people who are first responders with fire, so firemen, firewomen who manage a lot of trauma in their system, and we can see the adverse physical and mental effects of that. And so I'm really excited about group treatment in addition to individual treatment. And then the other piece that is important to talk about is there's an above ground approach to psychedelics, and then there's a below ground. And so it's probably worth for us to have a conversation about that.
Yeah. Well, let's hover over ketamine just for a minute. Um, we've done some ketamine assisted therapy in Topanga. Um, in your experience, what is the delivery, the optimal delivery, the optimal dosage? I mean, the nice thing about ketamine is it seems like that the duration of the quote unquote trip is pretty short, right? It's like 30 or 40 minutes, but I think it can vary. So maybe take us through what the experience is like for would you refer to them as a patient? I'm not sure in this case, but for the,
Well, this is where there's some blurred lines.
yeah,
So, a patient is someone that I've got an established physician-patient relationship with.
right.
With a group process, you don't always have that. But
Hmm.
if I'm the physician who's dispensing the ketamine, then I want to have a physician-patient relationship.
Hmm.
So with ketamine is super interesting. A lot of people think in terms of a false dichotomy of what are natural medicines that can get you into a healing state of consciousness versus the ones that are more synthetic.
Yeah.
And ketamine is, I've used it for 30 years as an anesthetic. It's something we use in the emergency room. And then I would say over the past 4 to 5 years, I've used it more with my clients. And it's not so much the response to ketamine, it's what continues to happen in your body for the 3 to 4 days afterwards, where I think the magic really happens.
Mm.
So, ketamine's not a classic psychedelic. At lower doses, it's got an empathogenic effect. At higher doses, it has more of an entheogenic effect. And it can be psychedelic at higher doses. So, in terms of dosing, if we start with sublingual dosing, so I use a compounding pharmacy to make lozenges.
Hmm.
And I typically start most of my clients at 100 milligrams. If they've got anxiety, I sometimes will start them lower, like around 50 milligrams, and then I'll give the option to redose after
Hmm.
45 minutes. Um, and then the second journey, I'll offer 200 milligrams, and the third journey, I'll offer 300 milligrams. So it's a way of understanding dose response and bioindividuality.
Hmm.
So the way that it's dispensed, um, when we give it as a lozenge, in some ways that's the easiest. So you can get it from a compounding pharmacy, you can take it, be with your client as they go through this process, guide them through it, help them activate their own innate healing intelligence, which is a really important through line of this type of work. You can also give it intramuscularly, which gives a much more intense response, and that's dose based on weight. You can also give it intravenously, also dose based on weight. And then you can take it intranasally, and I don't have experience with that.
Yeah, that's the S ketamine or something. One
Yes,
of them. Yeah.
esketamine.
Yeah, the IV is interesting because you can titrate the dose, right? So it's like if someone's having a negative like hallucinatory or dissociative experience, it's pretty much over right away because but the problem is like you don't really want to be walking around with an IV
Right.
necessarily
Right.
while you're having this experience.
It's
So
very
that's yeah.
medicalizing.
Yeah.
But on the other hand, a lot of the randomized trials looking at the effect of ketamine are with intravenous ketamine.
Sure.
So
Yeah.
there's advantages and disadvantages.
Yeah. So then there's the experience itself. I mean, in your administration, is it like an hour or how long is the actual experience? And then maybe take us through the integration process.
So it depends on how you metabolize it. For some
Mhm.
people, it can be a 45-minute experience, sometimes faster. Some people take longer and it can be a 75-minute experience. But
Right.
certainly compared to things like psilocybin, which are more like a,
Yeah.
5 to 6 hour experience, or MDMA, which is similar, 4 to 6 hours, it's a shorter experience. It's a good place to start,
Yeah.
especially because it's FDA approved. It's used off label, but it's
Right.
legal.
Yeah. Got it. And so then what does the integration experience look like? Is it essentially a post experience um, kind of talk therapy, or what does that look like generally?
There's a lot of different approaches to it. So, with the MDMA assisted therapy protocol that was developed by MAPS, there's a specific way that integration is performed. And in some ways, that's been applied to other medicines as well. So, typically, the most critical part of the experience you would think would be the medication, but I would say integration is the
Hmm.
most critical part,
Yeah.
especially for changing some of those grooves that you have in your mind. I've heard them described as kind of like when you're skiing down a mountain and you're kind of in the same tracks that you're always in. Those are kind of like the grooves of your mind. And what we're trying to create is neuroplasticity. We're trying to find the fresh powder
Right.
where we start to create different pathways that could support your behaviors, your psychology, your immune system, your neurology, your endocrine system in a fresh way. So, the method that I use is Hakomi.
Hmm.
Hakomi is a somatic, mindfulness based area of self study, self experimentation. And it's got a particular method, kind of a systems based method that you perform with your clients. And I find that that pairs with psychedelic medicine, with ketamine, with MDMA really well.
Hmm.
So I use that in the integration process as a way of helping people become more embodied, especially I'm a lot of people who come to work with me are people who've got that functional dissociation and they tend to go cognitive and they think back to like a trauma that occurred in childhood and they're using their cognitive approach to try to deal with it and
Sure.
it's
Yeah.
not working, it's kind of stuck.
Yeah.
And so having a more embodied approach I think can be very helpful.
Yeah.
So that's what I'm trained in.
Hmm.
And other people use other methods. A lot of people who are therapists and layer on psychedelic assisted therapy training, they'll use, some sort of combination of things that they've learned, whether that's Gestalt therapy or somatic experiencing or, a more psychodynamic approach. But the idea is to do this bottom up,
Hmm.
which you invoked previously. So it's not, a drill sergeant who's saying, okay, Jeff, we're going to go back to that memory and we're going to do XYZ. It's much more, Jeff, what are you noticing in your body as you feel back into that memory?
Hmm.
What do you, if you close your eyes and you tune into your breath, what are you noticing? And so it's a way to really work with these parts of the body where the biological embedding occurs and to create this kind of fresh wiring.
Hmm.
Another technique that I'm not trained in, but I've experienced as a client is the neuroemotional technique. It's something that we've studied quite a bit at Thomas Jefferson University. Dan Monti, the chair of our department, is masterful at it. And he's looked at it, for instance, with not with psychedelic assisted therapy, but with patients who've survived a cancer diagnosis and treatment as a way of working to resolve some of the trauma of that experience. And he's found, for instance, that the cerebellum, when you do neuroimaging of people who receive some of these trauma-informed therapies, that the cerebellum and the way it lights up on neuroimaging changes pre-post treatment.
Mm.
And so part of what we're trying to create is this reset
Yeah.
in the networks of the body.
Right. To disrupt that default mode network. To essentially find, new ski tracks, which is, I think, a really potent visual metaphor. I mean, it seems like neuroplasticity here really just is the key. And
Yes.
it appears like there's different ways at it. I mean, I'm always into like the neurobiological mechanisms of it. Is it like the blockage of the NMDA receptor, which, that is something associated with ketamine, I think, which is basically, you're inhibiting the uptake of like glutamate. So like the excitatory neurotransmitter that's like stimulating action potentials all the time, and so you're inhibiting that. And then is that allowing essentially like, like sort of an opening up of the
That's
possibilities,
right.
as sort of an ego dissolution or like a reappraisal, a somatic reappraisal opportunity, or, I don't know. There's also like, I think psilocybin's more on like the serotogenic like burst or something. Does that offer this opportunity again to like rewire, um, the brain to establish new kind of synaptic connections, et cetera? So, um, I mean, I think it's fascinating, A, and B, it seems to be really effective.
Yes. Well, it's the effectiveness that got my attention.
Yeah.
And, for me, when the data on MDMA was first starting to emerge, when we're looking at, the work that MAPS has done in the world, and this was more like the phase 2 trials, when I started to see, oh my gosh, this medicine is so effective at resolving trauma, I felt an obligation to be able to offer it to my clients going forward.
Mhm.
And not only that, but to experience it myself, because I didn't feel like I could authentically dispense it to someone else unless I went through the path of, taking on my own trauma
Mhm.
and working with it with someone really skilled. So I think that's a critical piece. There are some therapists who go through psychedelic assisted therapy training who don't take these medicines.
Mhm.
I think that's a little trickier. I'm not
Yeah.
saying it can't happen, but it's trickier.
Yeah. What would you say to someone who is potentially struggling with mental issues or maybe has a diagnosed mental disorder and they're really looking for something and intrigued by psychedelic assisted therapy? Maybe other therapies have failed them, but it still seems scary. It seems scary for people because it is a somewhat of a surrender.
Yes.
So, what would you say to that person to make them feel potentially more comfortable with trying something?
Well, first, I would say that I would never try to talk someone into it. And if you have some cautions about it, then pay attention to that. If it's a lack of trust, if it's maybe old trauma wiring that's making you less willing to try it, then let's work on that. And secondly, I would say you have a good reason to be hopeful about these medications. When we look at ketamine, for instance, in treatment resistant depression, we think that, you know, 3 to 4 out of 5 respond to it. And that's so much better than the current treatments for depression. Now, if you look at a drug like Celexa and you look at a population of people with major depression, you have to treat 7, 8, 9 people for one person to benefit.
Yeah.
And so we're talking about, a much more effective treatment here. So I would say it's both and. You want to respect that caution and skepticism that people have and never force the issue or, push them to do something that they're not comfortable with, but also look at the underlying reasons for it. And then you want to share the data in a really, honest, unvarnished way. Here's what we know.
Yeah.
And you might be one of those people who doesn't respond.
Yeah.
You don't know.
Yeah. It appears like legally we're on the precipice of sort of a domino effect here, but I'm not exactly sure where we are, what the legal status is where. I obviously know that the ketamine therapy is legalized in California, with certain certifications. I think psilocybin perhaps in Oregon now.
In Oregon, also in Colorado,
Mhm.
and in Oakland, the city of Oakland, in Northern California, it was decriminalized. So there's different legal processes that are going on. Decriminalization is the first step with some places.
Got it. And then an MDA, what is it? Sorry, MNDA, that is, or ecstasy, is that legal anywhere? I don't even know.
No, so it's Schedule 1, so it's
Good.
not legal at this time. So it's
Got it.
considered a breakthrough medication, so you can use it in a research setting.
Uh-huh.
And as a licensed physician, that's pretty much the only place that I can send people right now to go be part of a research program until it is FDA approved. So the good news is, it used to be Johns Hopkins was sort of the center of psychedelic medicine. That's where you'd have to go to do a research study and to get MDMA assisted therapy. Now, there are so many universities that have a program in which you can enroll as a study subject.
Yeah, cool. So interesting. Well, Sarah, it's always such a treat. I mean, as usual, your finger is right on the pulse. And that's not even a metaphor in this particular case. But you continue to really push the edges of yourself too. Obviously just of medicine and where we're headed, but you always remain so curious, and you're always challenging yourself and challenging me. So I really appreciate it, and the autoimmune cure is, I know, going to be another huge success. Hey, thanks a lot for watching. If you enjoyed this video, then I think you'll love this one too.